Hello, this is Dr. Gay from First Lake MRI, and this is a patient we've seen over the past few months, one of three patients who are middle-aged or male. They come in with back pain or neck pain, and in this patient we saw this big area of low signal in the T1 sequence in the L3 vertebral body, also the L2 vertebral body, so it looks like probably a discitis with osteomyelitis. And if we put up the sagittal stir sequence, we see that there is some abnormality. The infection here looks like it goes anteriorly and over the L3 vertebral body. We talked to the patient's mother, found out that they were an IV drug abuser, and so we're like, yep, here we go. Discitis, osteomyelitis, and some infection into the anterior paraspinal soft tissues. So this is the first patient. And about a month later, here's a patient a little bit older than the last one, still middle-aged male, and they have very similar findings. You can see there's a discitis, osteomyelitis. Infection extends both posteriorly into the epidural space and anteriorly here. And this also had an epidural abscess here in the back that went all the way up to L1, this lobulated fluid collection. So really significant findings of discitis, osteomyelitis, bone destruction, epidural abscess that goes down here in the front and in the back all the way up here. So this is our second case. And again, we couldn't get in touch with the patient, but again, was able to get in touch with their parent, and they explained, yeah, they do have IV drug abuse. And so patient number 2, and now here today is another patient. Same thing, they're in roughly the same age group as the other ones, a male. And we see here, on this view it's hard to see much, but you can see that there's lots of prevertebral soft tissue swelling. The retropharyngeal and prevertebral soft tissue space is all filled up, and that catches the eye. Also, you can see the spinal cord is poorly defined down here. There's something in the epidural space here in the front, pushing on the spinal cord. On this T2 weighted sequence, we can see that there is some bone destruction, really prominent marrow edema in the vertebral bodies here. You see a little bit of fluid along the anterior margin here, also a little epidural abscess over here on the right-hand side, causing severe foraminal stenosis. And also, this in the front here, we see a little abscess. The prevertebral soft tissue space has this diffuse thickening and edema, and this little fluid collection looks like an abscess. You can see this inflammation on the stirs here a lot better. All that edema going into the longus coli muscles, all the way down here to the bottom here on the right and left hand side. So rip roaring osteomyelitis with an epidural abscess, and then this prominent retropharyngeal cellulitis and probable abscess here. So we tried to call them, of course they didn't pick up, and guess who we got? Their mom again, who's taking care of them still at this age. And so interesting to have these 3 males with the 3 similar findings, all IV drug abusers. So when you see something in this age group, just boom, don't have to think so hard. And that's it. So thank you very much.